Hello, Crystal.
Hi,
Very
Dr.
nice to
Jay.
see you.
Lovely to see you too.
So, yeah, today I just want to have kind of like a casual conversation, discussion with you. I know that you're an ADHD coach, so would like to hear more about ADHD coach. Can you please
Yes.
tell me about this profession and how did you get into this profession? Like what brought you into this field?
Yeah, sure. So, yes, I'm an ADHD coach, which means I'm qualified to be working with people who have been formally diagnosed with ADHD. And so that ranges from young people, so children, through to adults, as well as families, so parents of children who have been diagnosed with ADHD as well. And so what I do as an ADHD coach is I partner with my clients to actually help them understand their ADHD brains because ADHD brains are wired very differently to neurotypical persons, and so there are lots of different challenges that ADHD people encounter day to day. And so what I do is I partner with them to understand their brains and to understand where some of their challenges are, and to also work with them to develop some strategies to be able to overcome some challenges, and also some skills, so learning and developing some of the skills that they need. Yeah.
So sounds like kind of talking to help. First of all, it's to help them understand
Yes.
what they're dealing with,
Yeah.
the symptoms, and how to manage. Is
Yes,
that correct?
that's correct.
So
Yeah.
do you usually like work with like let's say a psychologist or any providers after they maybe like have given out the diagnosis,
Yes.
or how does it work with like you getting the referrals or working with the parents
Yes.
or individuals like kids?
Yeah, so definitely, as you said, so I work closely with diagnosing clinicians who actually diagnose ADHD. And then often part of the treatment plan is to explore all the different strategies. So there's often, a medication option, but as well as a non-medication option, which is ADHD coaching. And so I actually do work with those diagnosing clinicians who are diagnosing to actually refer patients to me, so that we can be talking around that day-to-day challenge. Yeah.
And what brought you into this profession?
Yes. Well, I was actually diagnosed with ADHD myself. I was late diagnosed as a 41-year-old. So I've only been diagnosed for not very long. And so that was massive, like a revelation to me, because I'd spent 40 years from struggling. I did quite well at school, but I managed to find all these different ways to cope. But then when I got my diagnosis, it was like incredible, because it really explained so much in terms of my childhood and the challenges that I was having. So that's why I actually moved into ADHD coaching. Yeah, so I was a qualified coach to work with applied coaching, leadership, executive, kind of that sort of coaching as well. But then when I got my diagnosis, I actually moved on and did specialize in ADHD coaching.
That's very
coaching.
interesting.
Yeah.
And so to kind of go back to what you said just now, growing up with ADHD or experienced the symptoms, specific challenges that you had, like maybe can you share a little bit about like what was it like in school? I mean, I know you did mention that academically you did well, and to me I agree that not everyone with ADHD would perform poorly at school, right?
Yes.
Like in fact there are many people out there who can actually
Yes.
perform really,
Really
well,
well.
and
Yeah.
could get by and go through like all school years without
Yes.
any issues.
Yeah.
Any other areas in addition or other than academic performance that you would say like might be like a challenge?
Yeah. So, I mean, I think academic was a challenge, but because I was academically minded, that was motivation for me. So I worked very, very hard. So what I did was work extra hard, like a lot harder than probably my peers did to do academically well, because I struggled with the executive functioning, like the time management, studying, my memory was poor. And so I actually just worked very hard, which wasn't necessarily a good thing. Right, because that led to burnout and stress, right, and emotional side of things. So the emotional regulation piece was really, really difficult, like getting really, frustrated when things didn't go right. So definitely they were some of my challenges as well. I think also socially there are some challenges with ADHD. So managing your impulse, not interrupting other people, and being seen as a bossy boots as a child. So those I've learned those skills by just observing, and so so I felt like that those were challenges that I just kind of learnt by accident just by observing, and so
What about your family? Like, what was it like? I think like in the family, did they notice, or was this something that discussed or talked about
No, not
in
at
the
all.
household?
Yeah, no one knew what it was actually. So again, many girls are their ADHD is not picked up because a lot of the inattention is in their mind, and so that comes across as anxiety or depression often. And so there's a lot of worrying, lots of overthinking, and so yes, my parents were aware that I was a worrier and an overthinker, but they didn't know anything about ADHD. So much so that they I still didn't pick it up, so nobody picked it up. So I was able to hide it. So ADHD is to do something called masking. So I was able to mask it very well. And so,
So it sounds to me that like, for you, took you those years to try to understand yourself and also find a way to compensate.
Yes, that's right.
And still, and try to like, get through school, did well. And, even though you had to take like extra time, but, it's pretty much just kind of like with what a lot of people would say, right? Like it takes a lot more effort and time to do as well.
Correct.
And to kind of maintain at that level.
That's it. Okay. It's very tiring physically and mentally. And so it does have that toll on our ADHDs who are masking in the same way. Yeah. For sure.
So when did you start to recognize more of, the impact on your daily functioning or in any other areas and decided maybe I should seek help or evaluation?
Yeah. Oh, it was interesting because it was COVID actually. So I was a runner, and so the routine and the rigidity and the structure of running and exercise managed the dopamine, like my so with an ADHD brain, as you know, Dr. J, that ADHDs don't have the same amount of dopamine as neurotypical people, and so you can find that from exercise or from doing routine. And so I was actually what was I doing? Training, yes, quite a lot for trail running. And then COVID happened. And so obviously we were locked down, was not able to go out running in the same way. And so my organisation and the symptoms really started to become more affected because I did not have that release and that structure outside with the running. And so, that's when, and my colleague, who was very open with his diagnosis, actually shared what he was going through. And so, again, I was like, oh, some of those symptoms sound very much like me, so much so that my friend was like, oh yeah, you've definitely got it. And I was like, what? And so so it took someone else to recognise the symptoms in me during COVID when my routines had disappeared.
I see. And so you decided to seek
a diagnosis.
A diagnosis. Okay. Do you mind sharing a little bit about that journey?
Yes, sure. So I'm Australian, as you can probably tell from my accent, and so in Australia, because it depends on where you are in terms of how you can get diagnosed. So basically, what I did was I went to my general practitioner, who actually helped me do a self-diagnosis test. So he actually administered it for me. I passed with flying colours, and so which meant that he referred me to a diagnosing psychiatrist in Australia. So you must be a psychiatrist to be able to diagnose. And so then I was put on a wait list for him. And then he actually saw me and he diagnosed me over 3 sessions. So it's very much around seeing, for adults to be diagnosed, it has to be present as a child. And so my family actually did get interviewed. So my mother and my sister as well got interviewed because it has to be present as a child. And you couldn't see it in my reports. So he also looked at my reports, and my school reports were amazing. So there was nothing there that actually gave any evidence. So that's where he needed my mum and my sister to actually corroborate some of the challenges that I was they could see me have as a child.
Okay. And so after getting the diagnosis, how did you feel? I think you might have touched on that a little bit, but
it was amazing. It was like a relief because I had spent all my years, 40 years, thinking I was broken. Stupid, too dumb, too lazy, too anything to get unmotivated. And so it was a relief to actually realise that it wasn't me. It was something in my brain. I was wired differently. And so with that knowledge, it gave me power to be able to do something about it. And so I actually worked with my own ADHD coach. So this was before I became an ADHD coach. I actually had an ADHD coach, and she helped me change my mindset and really start to accept some of the challenges and see them as like strengths. And so that's why, another reason why I moved into ADHD coaching, because I'd love to be able to help, young people like me who have been diagnosed to be able to kind of kick their goals in life, and thrive.
I hear the differences here with how you describe your feelings. So prior to getting the diagnosis, you said with a lot of challenges and a lot of effort to try to maintain and just kind of have a kind of live up to your own standard or other people's standard. You said that maybe like lower self-esteem, felt like maybe am I lazy or not, X, Y, and Z, right? And after getting a diagnosis, understanding that, okay, something is going on here and I'm okay with it because now I know what's going on.
Yes.
And you said you feel relieved, empowered. And I hope that it also helps knowing what to do next, right? Like in terms of how to handle or how to manage. And you decided to go with the training, kind of like the coaching route, and also medication as well, or no medication?
Yes, I'm actually medicated at the moment, and so I know medication is not for all people, but it actually helped me a lot. It was like night and day. After I took the medication, I was like, oh my goodness, is this what normal people feel like? I spent my whole adult life thinking that after work you lay on the couch and have a little nap because you're so tired. And so I realised I was actually ADHD because I was concentrating so hard at work to maintain focus and to be present and to to do well at work that I was exhausted. And so I had to have a little nap on the couch. And I was like, what do you mean that's not normal? Like, doesn't everybody do that? And then when I had my medication, I was like, oh my goodness, I've got all this energy after work because I didn't have to use the medication helped with the concentration and the focus at work, so I didn't have to concentrate as hard.
So with the session that you do with your clients as an ADHD coach, are most of them on medication as well, or?
It depends actually. So some are on medication, some are exploring it, some would like options because sometimes you can't have medication all the time and it does wear off. And so, sometimes you can be taking it at school or work, for example, for big meetings or, meaning to focus. But then after school and after work, that's when the emotional dysregulation and the executive function challenges start creeping in. And so that's often when I'm actually using coaching. So strategies, around routine, planning, emotional regulation, all of that sort of stuff to kind of to work in tandem with medication.
Okay. And also first-hand experience of ADHD, right? Like, how do you think this helps you in your career?
It's helped me not be so hard on myself. So that's been the biggest thing. So it's like I talk about radical self-acceptance in my coaching, and so my clients are very hard on themselves. Because they're comparing themselves to neurotypicals, you find it a lot easier. And so there's a lot of, I should do this, I should do that. And so, but if you can be practicing that acceptance because it's not your fault, it's something to do with your brain, then it actually helps you to be able to do something about it. And so that's why, for me, that's made a difference to me because I've been able to understand that and realise it's not me. And then be able to do something about it. And so it's actually been able to open doors for me to actually achieve the goals that I want to be achieving.
So I guess with this, working with your clients, you're able to empathize.
Yes, absolutely.
And relate and kind of help them through the
absolutely.
same.
It's very challenging. And lots of people with ADHD think they're the only ones who are going through that. But actually, it's very common. And so it's about building that shared understanding and going, it's not just me. And other people can be successful as well. And so we often talk around that in coaching as well. So it's around empowering people to be able to actually not feel so lonely and actually manage those challenges day to day.
If you were to give suggestions or recommendations to, let's say, like parents or any individuals who might be struggling or suspecting ADHD, what would be like your recommendation for them?
I would recommend, I think going to go to your general practitioner and actually talking to them about it. Maybe doing some reading as well around it and seeing, you know, there's a lot of material out there online, and so maybe just doing some more reading to, you know, kind of inform yourself around ADHD as well, because it actually looks like different things. And so if you're suspecting something's going on, it's worth going to your medical practitioner to actually check it out, so they can actually help diagnose whether it is that or it might be something else. So yeah, that's what I would recommend.
In terms of like treatment,
yes,
any recommendation as well?
Yeah, for sure. Well, obviously I'm speaking from lived experience, so definitely I would be talking to your diagnosing practitioner and seeing if medication is possible for you, as well as, you know, thinking around, again, the non-medicated med process, which is the ADHD coaching, or, you know, therapy is also another option. So some people prefer to talk to their therapists or the psychologist about that as well. But yeah, there's lots of different options, but definitely I think finding all the support that you can around managing your ADHD, I think is, yeah, my recommendation. Yeah.
Would you also add that the earlier the better in terms of like finding out?
Absolutely. Yeah, because the earlier you know, the earlier you can understand, and then the earlier you can advocate for yourself and really, and also practice the skills, because it takes time to practice some of these skills, right, that are a bit challenging. And so the earlier you can do it, then the more chance you have, the more time you have to actually, you know, embed those skills. Yeah.
All right. Yeah. Is there anything else that you would like to add here?
I want to add that ADHD, while it can be a challenge, is also a superpower. Like, it's amazing. I know so many amazingly creative, smart, incredible, creative people who have got ADHD, that I think that it should be something that we embrace as opposed to be ashamed of, because there are so many people with ADHD, right? And so, yeah, they're really successful lives. So yeah, that's probably what I would add.
I definitely agree with you. I mean, like, you know, like having ADHD doesn't mean that, you know, it's a bad thing, right? No. There's definitely pros, and also if you understand your symptoms, and first, I mean, you know, if you suspect, then maybe like seek help, seek evaluation to better understand how like your brain works and your strength, and the area that you might need to be, like, you know, the areas that need to be strengthened, I would say. Then after, you know, having the answer, then you know how to kind of manage and deal with your life after, and, you know, with the strength, with the areas that really help you like improve and progress in your area, then use that to even like, you know,
catapult
push
your,
you further.
Exactly. You can definitely be kicking all your goals once you know it, because information is power, right? And so, and that can help you definitely if you want to. Yeah.
All right. Sure. Well, I really appreciate the talk today. I mean, this is really helpful, and a lot of information, and, you know, hearing from like someone who's dealing with it, like the first-hand experience, and, you know, just the whole process, and also with your career as an ADHD coach as well. So thank you so much for your time.
Thank you so much, Dr. Jay. Lovely to talk to you.
Lovely to talk to you.
Thank you.